Good evening, mga AVN warriors, mga arthritis warriors. This is Dr. Joff and I'm streaming live dito sa Cebu. Let me know where you are from. And of course, I want to know if you're from Luzon, Visayas, Mindanao. I also know that we have mga international Arthritis AVN warriors. May mga iba nakikinig sa ibang bansa po. Really happy to be here. This is actually the second AVN forum. The first one, if I'm not mistaken, was 2021 po. So if you are here with me right now, we are live from Cebu. Let me know where you are from. Comment in the chat below po. Type, taga Cebu ka ba, taga Bohol, Leyte, Mindanao, anywhere in Luzon. Really want to know where you are from. And I also want to know po if you can hear me. Kasi po, I really am not sure if you are listening to me or hearing because I've had live broadcast na walang sound or no sound. So, really want to know if you are listening live po dito sa Facebook. Again, the topic tonight is a question and answer forum, and this is about avascular necrosis or AVN of the hip po. This is something that affects a lot of Filipinos, and especially yung mga very young Filipinos na about 20-30 years old, kailangan na ng mga joint replacement po. I'm just want to share with you some of the patients po that I've seen are about 20 years old, yung mga youngest na mga na hip replacement po. Oh, good evening, Ma'am Maria Elena Mantaring. Salamat po. So, a lot of these patients are really suffering. It's really difficult para sa mga Pilipino. I've had patients who have a lot of issues with their hip. Yung mga iba already limping. One patient had to come all over from Leyte because naghahanap po siya sa surgeon na gumagawa ng yung minimally invasive direct anterior approach. Gusto kasi niya makalakad agad without pain, without cutting muscle. This is now possible po. So, I prepared a presentation for the AVN warriors. And of course, I want to know if you are listening, mga AVN warriors, let me know where you are from. Are you here in Cebu? Are you here in the Philippines? Or are you abroad? I wonder, taga saan si Ma'am? Where are you listening, Ma'am Maria Elena Mantaring? She is saying that she hears me loud and clear po. Curious lang po ako. Anyway, moving on, a lot of patients who have avascular necrosis, they actually go to an orthopedic surgeon already very late. Ibig sabihin, end stage na po. There are different early stages na pwedeng ma-save kasi. Oh, si Ma'am Elena is from Cebu. Good evening po sa iyo, Ma'am Elena. Happy to hear that you are from Cebu po. Also, I want to share with you na a lot of these patients, we would like to save your hip. It's not na gusto kaming or gusto naming mga surgeon mag hip replacement agad. We want po to save your hip if you are seen early by your doctor. If makita natin may early AVN, we do not do immediate yung tinatawag na hip replacement. We want to save that hip, save that femoral head if possible. Uy, good evening. Ma'am, it's BD. I'm not sure how to pronounce, pero please forgive me. AJ, LJBD. Hello po, good evening. Where are you from, sir, ma'am? Wanting to know where you are from. Are you here in Cebu? Are you in Visayas? Are you in the Philippines or abroad po? Going back, a lot of the patients we want to save So sad lang po na we see these patients pag severe na yung mga hips na arthritis po. What I'm showing you right now on the screen is actually a severe arthritis na on both the left and the right hips po. So for those of you na gusto malaman, good evening po, Sir Junmar. Junmar from Davao and from Bato Leyte. Acknowledging, this is Ma'am Cristitura Kesultura from Bato Leyte. From Davao, Bato Leyte, Cebu, and Ma'am Glenda Ruby. Hello po, good evening. And if I'm not mistaken, she is a nurse in King Fahad Hospital. Good evening po, Ma'am Glenda Ruby. Moving forward, again, these are x-rays showing you severe arthritis. When these patients have severe arthritis, they cannot walk properly. Initially, they have pain in the groin or bugan, nandito banda sa bugan po. And sometimes, yung tinatawag na singit or punuan, the pain goes from the groin to the thigh and the inner side of the knee po. So, this is something that really bothers them. I see a lot of patients already limping, paika-ika na po sila. They're limping, they're not really able to walk properly. And mind you, many of these patients are 20 years old, 30 years old. So some severe arthritis na I usually see in mga 60, 70, 80 years old can already happen in these very young patients. Now, for those of you who don't know what a normal hip looks like, it's opposite sa nakikita niyo ngayon. It's not really like this. I'm going to show you the normal hip on one side and the other x-ray arthritis of both hips. I'm going to show you that the normal pelvis AP or hip x-rays are showing rounded heads, a lot of joint space, and these patients can walk normally. No pain in the groin, walang sakit sa bugan or punuan or singit, no pain on the thigh. A lot of these patients, if early stages of AVN, you need an MRI kasi to know if there is something happening in the hip. The MRI will show possibly the femoral head inflamed, and that's why in very early cases, you may need an MRI if your doctor is suspicious na may AVN nangyayari. Oh, thank you for sharing, Sir Junmar. I had mine early at 17 years old. Wow, so at 17 years old, and then nag-severe siya nung 21 years old. So these are common stories. Thank you for sharing, Sir Junmar. A lot of the patients are like this po. They get very early AVN, and that is why they have formed the AVN Warriors group. It is a group of Filipinos with avascular necrosis helping each other, and hopefully you can join if you have some AVN or severe arthritis or dysplasia. This group can very much help you po. So that's why I'm really asking, if you know someone with severe hip arthritis, you can join the group. It's free to join. It's on Facebook. And it's a private chat group po. So again, I'm showing you severe arthritis on both hips. And this is why there is no more joint space, deformed femoral head. It's no longer round po. Hindi na bilog. And we have collected questions from the AVN Warriors. Doc Joff, ito po yung mga tanong ng mga AVN Warriors. We'll go to the first question after I show you what AVN or osteonecrosis is like. This is what happens. The femoral head in the groin area becomes deformed because there is a damage to the blood supply of the bone. From a normal rounded hip, it becomes a severe arthritis po. And when it is severe, that is the time that We do a total hip replacement if there is severe arthritis so that you can walk again properly and get quality of life. You can travel again, go back to sports. But again, if we can catch it early, you may not need a hip replacement. At least right away, it's something that we do. We do a core decompression din. And we've had some success doing this for patients with early AVN. The first question po from the AVN Warriors, Doc Joff, how do we get AVN? Paano po nakukuha namin yung avascular necrosis? Well, to make a long story short, there is damage or loss of blood to the femur head bone. So the femoral head, the rounded part po in your hip, loses its blood supply because of many factors. Some of it, the very common causes are steroids. May nagtitake ng steroids because they think it is a cure-all. Sometimes they take it because a lot of their friends advise it. Hindi nila alam that chronic steroid use causes the death of the head. And it is also a side effect if you have mga inflammatory arthritis. Chronic steroid use can also cause a vascular necrosis or AVN of the head. Other causes po are femoral trauma sa head. If you've had an accident and the bone is broken, if it is not fixed properly, or even if it's fixed properly, may chance pa rin po that the bone can die. And again, bone death because of the disruption of the blood supply is again a vascular necrosis or AVN po. Other causes are deep sea diving, yung tinatawag na Caisson's disease. It can also disrupt yung blood supply to the femoral head. There is alcoholism, so it's not just the liver that is destroyed by alcohol, it's also the blood supply to the femoral head. Smoking is another factor. I've had a very young smoker na patient. He takes 2 packs per day and now he has severe arthritis on the hip and is limping. There are metabolic causes and other diseases in the blood, lymphomas that can cause clotting disorders and again a vascular necrosis. So ito po yung unang question from the AVN Warriors group. And if you are someone with AVN, join the group and always consult your doctor. Please do not self-medicate with steroids po. It's going to be a fast way for you to get a vascular necrosis or AVN of the hip. We do have a chat group. Message us if you want to join the chat group po. We have members from all over the Philippines. So, and for those who are asking how they can contact me, I'm here in Cebu. It's my only clinic sa Robinsons Cybergate po. The next question, we move on. Ay, good evening po, Ma'am Charisse Diano from Pacnaan, Mandaue City. So good evening po. I hope you get value from this and hope to see you soon po. The next question is, how long po full recovery to a normal walk after a hip replacement? So in most patients, the dislocation precautions is removed after 3 months, and that is the time everything has healed. But it doesn't mean to say that you need to wait 3 months before you can walk properly. Some patients can walk fast, normally, even within a few weeks of surgery. So the normal walk can be affected by which approach the surgeon does. Sa front po ba or anterior? Sa likod po ba or posterior? The more muscles cut in general, the slower your rehab will be. But in general, by 6 weeks, if you have been doing your rehab properly, so it doesn't take 3 months, at most for patients who are doing good rehab, about 6 weeks po, you can do normal walking na po. I personally do the anterior approach because I've seen that patients can walk faster with less pain, and that's how I see the data, the studies are going more towards minimally invasive surgery kasi we want our patients out of the hospital as soon as possible, and this is the way they are doing it abroad. Outpatient hip replacements are being done through this anterior approach. Good evening po, Ma'am Ornelia Necesario. She is a nurse in the US, and I think she's having a holiday somewhere. So good evening po, Ma'am Ornelia. I hope that answers the question of how long you can have a normal walk after hip replacements. Most patients at 6 weeks, but it really depends on the surgeon. So it's best that you always consult po your doctor po. Now, so I'm going to show you some patients. This is a patient na before surgery. This patient had a very painful limp po. So if you can see him walking, may limp, he's going like that. And he has a foot that's rotated outward, hindi niya maikot yung foot niya. And this is before surgery. How fast was he able to do a normal walk? Now let's take a look. Dito po is 1 week after surgery, he was walking with crutches po. Now, it's a little bit slow because he has medications that cause a lot of swelling around the hip. He's taking a lot of blood thinners for his medical condition po. That's week after surgery. Now, this is 3 weeks after direct anterior hip replacement. Now, he's no longer using the walker. There is still a slight limp, no? And let's see him a month after surgery. Again, no more walker. He has yung tinatawag na compression socks po. And let's see if the video is working. This is the time na nagno-normalize na po yung lakad po. About a month after surgery. We have a little bit of technical difficulties. So, okay. Oh, M. Joy Magbanwa Estremera from Cabangcalan City. Good evening po. So, this is another patient na severe na yung hip pain niya. She could not walk without crutches and tumutusok na the bone was already piercing. That's why she had to have crutches. After surgery, again, 3 weeks was the time where she was able to get rid of the walker. So a lot of patients, hindi totoo po. It's not true that you cannot walk after surgery. We actually do surgery so that you can walk again and even get back into the things that you love. And a couple of months after, she was already working. I think she works with the DPWH, checking out the roads. So again, this is approximately about a month. For other patients, 6 weeks. So a month and a half, normal na po yung lakad nila. But again, not every patient is the same. So always po ask your doctor, and if you have concerns, if you want to talk to people who are like you na yung iba tapos na yung surgery, yung iba wala pa na operahan, as patients who are afraid, patients who are inspiring, patients who know how to get through the different pasikot-sikot po in life and in hospitals, join the AVN Warriors chat group. Again, it's free to join. And if you want to contact me, you can message me through Facebook Messenger or see me in the clinic in Cebu po. So, going to the next question sa AVN Warriors chat group. Possible po ba ma-dislocate ang hip implants years after surgery? Now, this is very rare po, but yes, dislocations can occur. But it's very rare after 3 months because everything has already healed. Typically, we disregard the dislocation precaution. So, if your surgeon mentioned na bawal mag-D4, bawal umupo ng very low seat, you can actually do this after 3 months. But again, always consult your doctor doing the surgery. They would know more because they know what happened and they know about the implants. But it is possible to get a dislocation years after surgery. Here is a patient showing that even trauma, motor vehicular accidents can dislocate normal hips. It can dislocate normal hips. It can also dislocate yung hip replacement po. So this is possible. Other causes aside from trauma or vehicular accidents, it can be loosening from infection or aseptic loosening. And if it is an early dislocation, that can also happen from malposition of the implants. I've had a patient send me an x-ray from Bohol. The surgeon tried to reduce it twice and the patient still was not able to walk. So they came to Cebu. Again, when we got the x-ray, it was still dislocated, and I think the patient already knew that if we don't do something, she could not walk again. So we put in a new cup, we changed the position, and long story short, she is now walking po. This is her video a couple of weeks after surgery. She still has some walkers, and I'll try to share in the future yung walk niya. She's now able to walk without the walker, and she's back in Bohol. She's teaching na happily po. Belated happy Teacher's Day po. So, again, dislocations can happen. That's why I always want you to consult your doctor. They know what approach was used. They know the precautions, when they can remove those precautions, and always talk to your doctor so that you can have the best care possible po. And if you would like, join the AVN Warriors chat groups for more advice from those who are exactly like you po, those who have had a hip replacements and those who are wanting to get a hip replacements. You can also contact me or see me at the clinic po. Now, going on, moving to the next question sa mga AVN warriors natin. Hi, Dr. Joff. After hip replacement, can I carry my 1-year-old? This is very possible po, ma'am. You can carry your baby. And of course, this goes without saying. You need to be confident. You need to be strong. You need to have balance. And that means after the replacement, you need to do your rehab and physical therapy. Because if you don't have the balance, you won't have the strength and the confidence to carry your baby. And this is something that should motivate you to always do your rehab and always go back to your surgeon to check kumusta na yung walk niyo po. So, I'm also showing it's not just carrying your baby. Other patients will want to go back into sports. Pwede po mag-sports after sa hip replacement surgery? Yes. And you can see many articles around the world. This man is doing a triathlon. There's another guy showing he can run and do triathlon after joint replacement. Even biking. You can check this out on Google, on YouTube. The hip replacement patients want their quality of life para they can do what they used to be doing, things they love. If it's golf or tennis or gardening, these are some things that are important for you. It's very possible, but please always consult your doctors po. Because they, again, know what is best for you, knowing what implants were in. And if you want to talk to patients, again, I'm promoting the AVN support group in the Philippines and the AVN Warriors chat group. So, yes, we have a comment. Na-dislocate ang akong hip pero nag-wait pa mi sa money. Oh, I'm sorry to hear that po. So, if you have a dislocation and you don't have money, we also do charity surgeries for patients. So, you can definitely, consult for your hip if you would like. You can reach out and ask about charity surgeries. But of course, we need to do a consultation because I need to do a face-to-face physical examination of your hip po. And I'll do my best to help you if you have a dislocation that you would like fixed po. So we do what we call revision surgeries, meaning redo surgeries of the hip and the knee, but we need to be able to see these patients and their x-rays po. So thank you for your question po. We will talk about this at the end of the session. So another arthritis or AVN warrior was asking, and this was in a previous video, "Hi Doc, ask ko lang po, okay po ba yung position pag may hip replacement ka?" So our Muslim brothers are very religious, and the quick answer is yes. 89%, not all, no? 89% are able to do Muslim prayer after po sa hip replacement. And why 89%? Because again, not all patients are the same. Not all approaches and surgeons are the same also. The rehab that the patient does will also affect the recovery of the patient and po yung range of motion. So it really depends on the things that you want to do. You need to be part of the recovery team and talk to your rehab, talk to your surgeon about your concerns and what you want to achieve afterwards. Kasi it's not just surgery, it's also the work that you do during the recovery period, the rehab, the exercises and the stretches, so that you can do the things you love po. So I hope that helps. We also have a arthritis or AVN warrior asking a question, "Doc, can I make love after a hip replacement?" So this is a motion capture study done a few years ago, and they had males and females with hip replacements showing the positions that they can do during the act of making love. So just as a guide, the blue is the male, the female is the pink, and the positions have a check or an X, noting what you can and you cannot do during lovemaking if you have a hip replacement. Again, it's always best to ask your doctor po what you can and cannot do, because not all patients are the same and not all hip replacements are the same po. We have a question po from Ma'am Arminda. "Hello po Doc, nanay ko po na fracture yung hip, hindi na po nagpa-opera. Ask ko lang po Doc, makakalakad po ba siya Doc?" The short answer is no. I don't think that your mother understands siguro na hindi na siya makakalakad, because hip fractures do not heal po kasi. At that's why we told at the start of this question and answer forum, yung causes ng AVN or bone death is number one, trauma, like fractures. If you have a fracture, especially yung mga elderly po, what happens to the hip or the head? It will die. It will not heal. So it will go into AVN or avascular necrosis. It may get arthritis, but no, it will not heal. And if it will not heal, I'm sorry to say, I don't think that your mother can walk po if she is elderly and she has a hip fracture. In other countries, hip replacements for hip fractures are considered emergencies and they are done as quickly as possible. Matagal na po yung 3 days. The more you delay, the more muscles that you lose po. And it will be harder for these patients to walk again. So I hope that helps po. I hope po na yung nanay nyo changes her mind if she wants to walk again. So another question from our AVN warriors. "Doc, how many years would the implant last?" I'm 30 years old po. Thanks, Doc. So, sinasabi nila yung older implants based on biomechanical studies, meaning laboratory studies, they last 15 years. And the newer implants, of course, because they are very new, they are stronger in the laboratory. So, that is why we now say about 20 years and more, 20 to 30 years. And again, it's always best to ask your doctor. It's also good to point out what are your activities after yung hip replacement. Because if you're an athlete, again, if you want to do sports, it may actually lessen the lifespan of your implant. There are also different types of implants. There's metal on polyethylene. Polyethylene is a type of plastic. There's ceramic on polyethylene. And when this AVN warrior was talking to me, she was very knowledgeable. Ano yung mga best implants? There is a surgeon telling her that the ceramic on polyethylene is best. Another surgeon saying ceramic on ceramic is best. And to be honest, a lot of surgeons are looking into these two as the best. The studies are still ongoing, but they are very promising results for the ceramic on polyethylene, and the ceramic on ceramic is also a good hard-on-hard bearing. May mga squeaking lang in certain cases, but of course, it's not something that gets destroyed easily. That is why it's going to be about 20 years, sometimes even 30 years. We will need to see the results of the studies because, again, these implants are new, and in the lab, they can easily do 20 to 30 years, but in actual patients po, they are still being studied. So for me, personally, basing on the studies, it's ceramic on ceramic and ceramic on polyethylene. Again, the activities that you do may affect the lifespan of the hip. If you're running, if you're biking may be less stressful to the hip compared to running. And I want you to always consult po your doctor. If you want, you can join the AVN Warriors chat group po, or consult me. I'll be in the clinic in Cebu if you are anywhere near Cebu. Another question from the AVN Warriors chat po. Doc, can I do hiking after my hip surgery? And again, yes. In about 6 to 8 weeks, as long as you have good balance, you have good strength, you will get the confidence to walk again, hiking uphill. So during the recovery process, always consult your doctor, your surgeon. You want to start easy during your hiking, avoid leading forward po, and choose easier routes with less hazards po to avoid yung mga dislocation precautions early at the 3-month mark. So the quick answer is yes, and be aware lang po, always talk to your surgeon naman. Always consult your doctor and join the chat group if you have time. And I'm in Cebu if you need me. I have another patient. This patient is actually a ballerina. Doc, can I dance? Can I teach? Can I do ballet after the hip replacement? And again, it is the same answer as kanina po. Yes! Within 4 to 6 weeks, patients are again doing dancing and teaching even. They're able to regain their balance and strength. As long as you do your physical therapy po, you can definitely regain your confidence po. So always consult your doctor. This is a Filipina, Elizabeth Rojas Dobrich, one of the youngest members of Ballet Philippines. She got a hip replacement through the anterior approach and is again dancing and teaching ballet in the US. So you can check out her story on YouTube. It's there. I want you, of course, to always consult your doctor and, of course, join the AVN chat group so that you can talk to patients like yourself. And if you're in Cebu, come visit me. You can ask me questions po. Oh, we have a question from Seth. Doc, pag stage 1 AVN po ba, kaya po i-core decompression? Well, quick answer is yes po. If you do have AVN and it's an early stage, and it's really truly stage 1 on MRI and X-ray, that is the best treatment po. A core decompression can prolong the lifespan of your hip. And hopefully, if you have a treatable cause for your AVN, hopefully you get cured and you won't end up with a arthritic joint po. But again, it's really best if we examine you. Always consult po your doctor so that you can have the best advice. When we examine a patient with AVN, it's always the patient face to face so that we can do range of motion and test the hip. We check the x-ray and we check the MRI before we give the best advice. Since we're only doing Ma'am Steph or Sir Steph, yung tinatawag na question and answer dito, I am unable to answer your question the best I can. But I hope you get an idea po. Please always consult your doctor or someone, an orthopedic specialist sa hip. Hope this helps po. Another question here from the chat. From Ma'am Lilabeth. Hello po, Doc. Isa po akong breast cancer. Yung hips ko po na fracture. At naka-wheelchair na po ako. May chance pa ba ako? Okay. May chance pa ba ako makalakad? Kasi ngayon hindi na pantay yung paa ko. Naka-walker ako. At kung lumabas ako, naka-wheelchair po. Well, definitely po, we treat patients with hip fractures. And that is the way na makakalakad po kayo because cancer destroys the bone. So that is why a hip replacement is usually the best treatment if you want to walk again pag may bone fracture caused by cancer. So I hope that answers your question, Ma'am Lilabeth Pepito. Moving on po, meron po tayong AVN warrior na seafarer. Can I work as a seafarer after hip replacement? And the answer is yes. We can do a hip replacement. If you regain your balance, your strength, your confidence, then babalik kayo sa trabaho po. Again, always consult your doctor. Personally, I've had a few seafarer patients. My patient, after his hip replacement, was already climbing. I asked him for a video of him walking, and instead of a video, he just sent me a picture that says 1,000 words. He showed me a picture of his ship. He climbed all the way to the top. So he's now working again as a seafarer. Pwede po. The next question from our AVN Warriors chat group po. Doc, when do I know it's time that I really need surgery for my AVN? And this is a case-to-case basis po. Not all patients are the same. When I ask my patients, how is your pain pag severe end-stage AVN na? Some will have severe pain, then definitely they need surgery. Some will have minimal pain and they are learning to live with the AVN, then maybe they can delay po if they have mga financial issues or family issues that they need to do first or work issues. It really boils down to your quality of life. How are you naman po sa AVN niyo po? Are you having difficulty with your day-to-day life, with your work, with your travel? Because if you have severe pain, if you are limited na, and you cannot walk very far, then maybe it's time. And I always ask my patients yung question, what do you want to do again? Is there something that you are no longer able to do na gusto mong gawin? Patients will say, Doc, I want to travel. Doc, I want to work abroad. Doc, I want to do gardening again. Doc, I want to do sports again. Then you know it's time for your surgery if you want to do all these things. Because surgery po is not the end point. What you want is your life back, doing the things you love. And I hope this answers po yung question niyo po. I know that most people are afraid and a lot of people are in denial. So think about how you are physically. Nakakalakad pa ba? How is your pain? Is it severe? Emotionally, are you ready for surgery? Because if you are in fear, maybe it's not time yet. Because maybe you do not understand that this is one of the most successful surgeries, if not the most successful surgery in the world. 98% of patients are very happy. If you are financially not ready yet, maybe you need help or maybe you need charity surgery, which we provide po. or maybe spiritually it's not the time for you yet. You have other issues that you are tending to. So I hope this helps po sa nagtatanong when is it that I need my surgery. And next question from the AVN group. Doc, is it possible to get full range of motion after hip replacement if I have AVN and osteoarthritis already? The short answer is yes, it is possible. Of course, not right away. Not everyone will get it because not everyone will work hard and do the therapy for it. That's also because not everyone will need it. Other patients will just want to walk. Others will just want to do day-to-day activities. So if you don't do the therapy, if you don't do the stretches and the strengthening exercises, you may not get full range of motion. But we can definitely help you towards your goal, whether it is sports, whether it is prayer, whether it is your love life with your partner. We can do a talk so that we can guide you towards the process of getting the motion that you like po, or that you really want. If it's dancing, then you really need to work for your full range motion. If you just want to climb steps like may yung seaman ko na patient, that may be all you need. You don't need to get full range po. If you want to go biking, then you don't need to get full range. So, next question sa mga AVN chat group natin. Doc Joff, can you have both hips replaced at the same time? Yes, it is possible, but in patients with heart problems, septal defects, it is only advised that you do one joint at a time, not both po. So again, always consult your doctor because everyone will need medical clearance if may mga medical problems po. Especially for us here in Cebu, patients beyond 35 or 40 years old will need medical clearance from a cardiologist before any surgery, just to make sure that you are safe po. So this is again what we do in a hip replacement procedure. And the total hip replacement is where we replace both the ball and the socket portion of the hip po. And of course, this is the socket, because if you only focus on one, you may not get the pain relief that you need. And yes, we do both hips at the same time if the patient is medically cleared and if that is what they really desire. So this is something that you really need to talk with your doctor with, because every patient is different and there are pros and cons to be discussed before this surgery po. Then we have another question po. Will recovery be slower, doc, or faster if one hip is replaced versus both at the same time? So the factors are again, if you are medically cleared, ano po ba yung approach? Is it a MIS or minimally invasive surgery na walang muscles cut like the direct anterior approach? Is the rehab going to be very aggressive? And there are patient factors naman. Some patients would lie down and be depressed after one hip. So these are many factors to consider. But in general, it really depends on these things. The aggressiveness of your rehab, your motivation on what you want to achieve afterwards, and of course the approach and the surgery. So always consult your doctor because it's also a doctor preference if they want to be on the safe side, or your doctor is already an expert who does a lot of bilateral hips at the same time po. So for you who are asking about bilateral surgery, you need to consult the specialist who wants to do the surgery. Talk to him about what he's comfortable with and saan siya expert po. Hope this helps. So, what is this? Before I go on, I think we have mga questions no from our chat group that we would like to answer dito sa chat group. From Vin Clark Labiano, Doc, I'm in a motor accident. Survivor last December 2022. Doon ko po nakuha yung fracture sa femur head. Kaya I'll undergo hip replacement surgeries. Ilan years bago palitan yung bakal na kinabit? Like kagaya ko na 30 years old, thanks. I think, Sir Vin, we've already answered this question, but most patients, 20 to 30 years, depending po sa type of implant at saka depende sa mga activities na ginagawa nyo afterwards. So, not everyone will be the same. Again, the newer materials will also determine kung if you have a ceramic on ceramic or a ceramic on polyethylene, they are good implants that can last 20 to 30 years before papalitan po. And sometimes it's possible na longer. It really depends. So it's best that you talk to your surgeon, Sir Vin. Questions like, ano po ba yung implant ko? How long maglalast? Because they will know more than me po. Kasi alam nila kung ano yung ginamit. These surgeons who did your surgery would be the best person to ask because they know the implants that they used and they will know you as a patient better than me. So I hope this helps, Sir Vin. And next question is... Okay. So, yeah, hope that helps po. And moving on sa next question sa AVN chat group. Am I allowed to have a full body massage? Wow, full body massage. Parang that's something I need also to de-stress. Am I allowed, Doc, a full body massage with stage 2 AVN po on both my hips? I have no pain, I have no limitations now. And my answer is as long as they don't do a lot of stretching and they don't damage your hips. If it is a body massage, that's okay. But be careful. Tell them no lifting movement that may damage your hip. And again, if you have really a stage 2 AVN or not, it's best to consult the doctor that you saw because maybe it was stage 2 before, but now it may not be stage 2 anymore. And this can be a factor. I don't want to be the one that tells you that you can do this more than your doctor. It's always best for you to consult your doctor's po. But if it's only a very light massage, no lifting, no stretching, and it's only muscle, because massages generally target not the joint but muscles po. So muscles could be okay lang po. Now another question from the AVN warriors. Doc, is chiropractic massage allowed for those who've had a hip replacement? Personally, I'm not an expert. I cannot recommend also any chiropractor in the Philippines because they are not licensed doctors. Unlike in abroad, the chiropractors have a license to practice. They have their own PRC or regulatory commission. They've passed their board exams and they are considered doctors. Here in the Philippines, we have no regulation for the chiropractors. So I cannot recommend it for anyone, and you have to do it at your own risk po. Next question, Doc. What happens to me if I do not have surgery if my AVN is not treated with a hip replacement? So it really depends po what stage you are. If it's an early AVN, you may not need a hip replacement, but you will need a core decompression. If it's late stage na AVN, and if you are in pain, and like I mentioned, if you've lost your quality of life po, you are in severe pain, then it may get worse. And a lot of patients who I see end up in a wheelchair because they had not done surgery. And if that is something that you do not like to happen to you, if you don't want to end up in a wheelchair, it's best to consult your doctor. It's best po that You need to consult your doctor on what's going to happen in the future, because if I have not examined you, I really don't know what stage you are in your avascular necrosis. And that is why, for me, it's best that you consult the doctor near you po. Because if you're not treated with a hip replacement, maybe you don't need it if it's early. But if it's late, only time can tell what's going to happen to you. And it can be severe pain, that means you end up in a wheelchair. Or you could even learn to live with your AVN, maybe find a way to wobble. I've had patients who are afraid of surgery, so they walk like a penguin. And for them, that gives them no pain. So every day they walk like a penguin, and that's okay. So question from Ma'am Crestita. Doc, unsay meaning anang AVN? So again, AVN is a vascular necrosis of the hips, and it is a cause of severe arthritis po, Ma'am Crestita Quesultura. Oh, thank you also, Sir Junmar. Now, if you want to know what happens if you're not treated with a hip replacement and you are stage 4, just ask yourself what quality of life you want and if you learn to live with the pain. Because again, hip replacement is not the goal. The goal is walking, traveling, going to the church, going to the mall. Like if you want to go to the beach and travel, maybe that's the goal. You have to have a motivation. Surgery is again not the end point. If you want to go on a vacation, go to the beach, travel. If you want to go to the mall and do your malling, or just go with your family to the mall, do the grocery yourself, be independent in life, travel the city, go back to church every Sunday. These are the motivations that I'm sharing from other patients po. They want to go to church, they want to garden, they want to go do their biking again. These are reasons why patients get their hip replacements done. And for the last question, I think, what is the direct anterior hip replacement? Well, it's the approach that I prefer. Studies are showing this approach causes no damage or less damage to the muscles so that patients can walk again and get out of the hospital faster po. Less muscles or no muscles are cut, you have a faster recovery. I've had patients na 24 hours after their surgery are out of the hospital. So, I think this is the last question. Salamat sa Oh, there have a question from Sir Junmar. Doc, ibang doktor din po ba for AVN sa shoulders? I think that you have to have also a shoulder specialist because AVN can happen in different parts of the body. And for myself, I'm a hip and knee specialist. There are shoulder specialists, so it would be good to talk to shoulder specialists as well, Sir Junmar. And I hope this helps. AVN does not only happen in the hips, it can happen in the knee, it can happen in the shoulders. That is why it's very important to work with a internist who knows your case, who knows what is causing your AVN. Is it the smoking? Is it a metabolic disorder like diabetes? Is it a cancer or lymphoma? So if this cause is treated, sana hindi na kayo mag-AVN in other areas. Tapos pag na-treat yung hips, ma-treat na rin yung cause ng AVN po. And thank you po sa motivation and mindset, Doc Joff. Thank you din, Seth. And I hope you guys have had a wonderful night. I'm still taking questions. We have 5 more minutes before yung 8 p.m. live ends. I'm here to answer your questions about AVN, hip replacement, hip osteoarthritis. And if you have no more questions, I'm going to end this Facebook Live. So yeah, it seems like wala nang questions po. So thank you everyone. Have a great night. Please share your chat group, our chat group with those friends sa mga AVN warriors. You can share our group to those who are in need. I'm also a very passionate person in promoting the group. A lot of patients have knee osteoarthritis, but even though a lot of patients also have knee, I'm also not forgetting the AVN warriors. You're also close to my heart po, yung mga hip natin na patients po. So again, join the chat group. If you know someone with a hip AVN, hip osteoarthritis, join the chat group. We can get value and help each other po. Help support each other and help inspire each other. Thank you din, Ma'am Abigail. Thank you, everyone. Have a great night. So it's last 5 minutes for questions. And if there are no more questions po, you can PM me in the chat below or see me in Cebu